Hi, this is Terry Hush at Roji Health Intelligence. I'd like to talk to you today about value-based healthcare and race. There's a lot of discussion and interest right now in focusing on inequities in the healthcare system, but the problem that with a lot of the conversations that I see is that they focus on the environment that is external to healthcare, proper healthcare, meaning that we are looking at coverage and financial capabilities to access coverage. We're looking at the entire environment, but we're really not looking at us. And there is racial bias within healthcare too. We see it in a lot of different ways, and it's showing up in data and has for years, but this is the kind of thing that we have not addressed, and which creates outcomes that are disproportionately poor among people of color. So let me give you a couple examples. One of those is a frequent phrase that I hear, which is hypertension in Black people is a totally different disease. So we know that that is not exactly the case. What we do know is that people tend to present later and with more severe disease and with complications in organs like kidneys. It is too simplistic to say that that is solely due to race. It could be due to access to care. It could be due to the way people have visited us or how we are working with them on interventions as well. There are issues of racial bias that thread through symptoms, how we process symptoms and turn them into diagnoses, and this is very common in behavioral health. So a lot of these examples are in the written part of the blog this week. I encourage you to take a look at them and think about them. But the question for us is, how do we go about fixing it? And how do we use data in particular and use the interest of providers to try to ameliorate inequities in a really positive way? That's what we do at Roji Health Intelligence. We help providers look at their data and examine possible interventions and test those interventions to help improve.